On behalf of the School of Public Health at Georgia State University, I want to welcome you to the 2020 Kreuter Katz Lecture on Health Equity. I'm delighted that you're able to join us today as we honor my dear friends, Marshall Kreuter and Martha Katz, for their contributions to public health and their dedication to health equity. This presentation today would not be possible without the generous support of the Healthcare Georgia Foundation. We're really grateful to Dr. Gary Nelson, president of the foundation and member and former chair of the School of Public Health Board of Advisors. We really appreciate his longtime support and for the foundation's partnership with our School of Public Health. Today's lecture is focused on improving our understanding of health disparities in society to help to foster solutions. In June of this year, I called on our community of faculty, staff, students, and alumni, and friends, really, to come together to identify steps that we could take to strengthen our commitment to racial equity and inclusion. Deeply disturbed by the recent and repeated killing of African American citizens in our nation and by a global pandemic disproportionately affecting communities of color, we established a School of Public Health task force for racial equity and inclusion. Led by Dr. Collins Arian-Bua, the task force immediately began its work recommending actions to enhance our impact on anti-racist practices in our curriculum, research, student recruitment, hiring, and community engagement. Out of this work, Dr. Kim Ramsey White was recently named Special Advisor to the Dean for Diversity, Equity, and Inclusion. And I'm proud to announce today that we are establishing a standing diversity council for the school. The Diversity Council will carry forward the work of the task force and see that the recommendations that they've provided are fully executed. But we'll also be responsible for setting a mission, vision, and goals for the school related to diversity, equity, and inclusion broadly as we work to carry out our commitment to promoting social justice. Today, we're proud to host Ms. Angela Glover Blackwell as our distinguished speaker for the Kreuter Katz Lecture on Health Equity. She will focus on institutionalizing equity in public health practice. Ms. Blackwell is founder in residence at PolicyLink, the organization she started in 1999 to advance racial and economic equity for all. Under Ms. Blackwell's leadership, PolicyLink gained national prominence in the movement to use policy to improve access and opportunity for all low-income people and communities of color, particularly in the areas of health, housing, transportation, and infrastructure. Her Radical Imagination podcast debuted in September of 2019 and introduces listeners to a world of talented, creative, progressive thinkers whose vision and determination are challenging the status quo to create needed change. Prior to PolicyLink, Ms. Blackwell served as Senior Vice President at the Rockefeller Foundation. She's a lawyer by training. She gained national recognition as founder of the Urban Strategies Council. From 1977 to 1987, she was a partner at Public Advocates. Ms. Blackwell is the co-author of Uncommon Common Ground, Race and America's Future. She also authored The Curb Cut Effect, published in the Stanford Social Innovation Review in 2017. As a leading voice in the movement for equity in America, Ms. Blackwell serves on numerous boards. She's advised the Board of Governors of the Federal Reserve as one of 15 members of its inaugural Community Advisory Council. And in 2020, she was appointed by California Governor Gavin Newsom to the State Task Force on Business and Jobs Recovery. She is the 2018 recipient of the John W. Gardner Leadership Award presented by the Independent Sector. And in 2017, she received the Peter E. Haas Public Service Award from the University of California, Berkeley. We are really honored to have you with us today, Ms. Blackwell. Thank you for joining us. Following the presentation, there will be time for questions. Viewers are invited to submit questions by sending them to phevents@gsu.edu. Again, that's phevents@gsu.edu. At this time, I'd like to welcome you, Ms. Glover Blackwell, and thank you for being with us.
Thank you, Dean. It is such a pleasure and an honor to have the opportunity to talk with you and your expanded community. This is such an important moment for the country and for the field of public health. There's no question that after we get past this crisis, things will be different in this country. The question is whether or not we're going to be part of making sure that they're also better. This COVID-19 crisis has really brought a lot of things into sharp relief. One is that our nation is quite vulnerable in multiple ways. It's vulnerable in terms of health. It's vulnerable in terms of the economy. I think that a lot of people, perhaps not this community, but a lot of people were very surprised to see that we are in a crisis that we can't seem to get ourselves out of because it is being so profoundly impacted in communities that are often isolated from other parts of our community, but also isolated from healthcare, isolated from information, isolated from the support systems that are needed. The kind of neglect that has been just kind of taken for granted and become just the way things are done in this country has rendered a nation vulnerable to the health crisis that we're in. I think a lot of people were surprised to realize how interdependent we all are, what an interdependency we have in our economy. We're literally in a situation in which if the frontline workers can't go to work, America can't go to work. And the impact of that has really caused politicians and local leaders and institutions and whole sectors of the country to take a hard look at how vulnerable our economy is because of the isolation and the neglect that has just become part of the way the economy works. And while all of this is happening and people have eased up to an awareness of something that many people, myself certainly included, have been crying from the hilltops about for decades, and that is that race matters, that racism is totally embedded in every aspect of the nation. And it is a problem for the nation, not just for those who are victimized because of their race. And as people were understanding that, as they looked at the disproportionate impact on people who were Black and brown from the health crisis, as they looked at the disproportionate impact in the economy of those who are Black and brown because of where they sit in the economy and how that impacts everybody, we had the murder of George Floyd. Wasn't the first, but it was the one that captured the imagination of the nation in terms of finally being able to acknowledge that there is a deep problem with racism and it is ugly and it is deadly. Watching the murder of George Floyd on cable television, which everybody saw because we were on lockdown, glued to the television, glued to the news, and seeing the casual nature of that really shocked a lot of people into realizing that on top of the health, on top of the economy, the insights around race had brought us to a racial reckoning. And that's where we are right now. And that racial reckoning actually is going to be very much part of how we think about health and well-being going forward. For those of us who are swirling around issues of health and equity and public health, we've gotten very sophisticated in the recent past about why it is we need to focus on health equity. I go from the crisis to talking about health equity because one of the things about this crisis, it has brought a lot of the nation squarely into a conversation that oodles of us have been having for a long time, no place more than in the health arena, because health equity was on everybody's lips anyway. We've gotten pretty sophisticated in the health community about understanding that the nation was facing something new with the shifting demographics. The shifting demographics, and when I say that, what I'm referring to is that we are pretty rapidly becoming a nation in which the majority will be people of color. It'll happen by 2044, but since the summer of 2012, the majority of all babies born in this country have been of color. This year, we passed a milestone in which the majority of all children in this nation, 18 and under, are of color. And by 2030, the majority of the young workforce will be of color. So even though 2044 is when we'll see the whole nation recognize that shift, it's actually happened in many parts of society already. And people in health understood that as the nation was starting to be a little embarrassed and wring its hands and sort of ask hard questions about why the country was losing its status on the global stage in terms of being a healthy nation. Why on infant mortality and heart disease and other things, we were so low in relationship to other nations with whom we often compare ourselves. And I think people really had to recognize one of the reasons is because there were so many people who were poor, isolated from healthcare, isolated from the health supports that are needed, and many of them are people of color. So with this demographic shift, we were also seeing it begin to turn up in the indicators of well-being and begin to impact the status of the nation as its well-being indicators began to plummet. We talked about health disparities and the difference between the health outcomes for people who were Black and brown and indigenous and within some Asian groups and people who were white. The equity advocates, though, began to push back on just talking about health disparities and encouraged a focus on what do we want to do about it? Let's stop just bringing forward the data to talk about the disparities and let's have a goal. And let's have a goal that's bigger than just trying to close the gap between people who are of color and people who are white. Let's think about what everybody needs in order to achieve their best health and well-being. And we began to talk about health equity. Health equity caused people to think about, well, what brings about health inequity? And we began a couple of decades ago to get very focused on health and place, understanding that where you live, particularly in this country, is a proxy for opportunity. It determines whether or not you're situated close enough to a good school that you're going to get an education. It determines whether you're situated in a community where there are lots of jobs and it's a little easier for you to get one. It determines whether or not you're close to a public transit system that can connect you to work and opportunity throughout the region. It determines whether or not you are in a position to be able to own a home from which you can extract resources if you need them in a health emergency. It even determines how long you live and how well you live while you live. Everybody's seen the data. I have been very close to the Robert Wood Johnson Foundation over many years, and they have really put forward this notion about zip code and life expectancy, and we've all seen that data. I live in Oakland, California, and between the Berkeley Hills, which is an affluent area, and the Oakland Flatlands, which is less affluent, there's a 15-year life expectancy difference, even though the distance in space is really only about 3 miles. So we began to focus on place. And what that took us to was thinking about strategies. It's not enough just to say where you live impacts how long you live and how you live. But what do we do about it? One of the things we noticed was that it's very hard to have access to fresh fruits and vegetables if you live in a low-income Black community in particular, but not just the low-income Black communities. Other communities of color experience it as well. And we began to develop strategies. Farmers markets, getting more grocery stores in low-income communities. We even had a federal initiative, the Healthy Food Finance Initiative, to put money in place to get more fresh fruits and vegetables, particularly in grocery stores, in communities that got classified as food deserts. A whole strategy about improving the place where people live by improving access to food. We had another strategy that really tried to put an emphasis on public transit. And where does the public transit take people? Does it take people to places where they can get food? Does it connect people to places where they can access jobs? We began to focus on parks and be embarrassed and outraged as we looked at the absence of parks in low-income communities of color. And where there were parks and playgrounds, they weren't usable, they weren't safe, they weren't places that children could go and safely exercise, where elderly could go and walk, where families could go and get what they needed. We began to look at how we pollute low-income communities of color and develop strategies to do something about that. It was a good healthy run in terms of being able to say, let's not just identify the problem, let's have strategies that have a health orientation, not just food for economic development, but food for health, not just exercising in parks as things that are part of lifestyle, but those things for health. But as we looked more deeply, things began to emerge. For example, there was a strategy out of HUD called Moving to Opportunity, where the federal government actually began to develop an experiment of getting people who were in public housing, places in communities that were better off in terms of having opportunities, schools, other those kinds of things. The evaluation of it was not exactly what people were hoping for in terms of what the impact would be in terms of improved income. But one thing that was a surprise was improved health. It suggested that being able to live in in a community of opportunity could improve health. But that actually sparked a lot of conversation about race because the big reason why people aren't moving to opportunity communities is often because of race discrimination in housing that continues to operate. And sometimes when people who were Black and Brown moved into these communities that had more opportunity, if they were also mostly white, they didn't feel welcome. And so we began to really get a little more comfortable talking about race. As a matter of fact, one of the things that I think has been really enlightening is that people began to actually see that we were talking about place because we couldn't talk about race, because we were in many settings where that just wasn't accepted, that place had become a proxy for race. And that once we began to just get away from that and say, well, let's just go and talk about race, a lot of things opened up. One thing that's been really enlightening for many people is to read The Color of Law by Richard Rothstein, in which he goes back and takes a historical look at why we have so much housing segregation, how deliberate it has been. And even as we have gotten rid of laws that have enforced segregated housing, housing has continued to be segregated. And our development patterns and our investment absolutely track the redlining maps of the days past in terms of what we see in terms of days present. That book, Placing Things in a Historical Context, has been really meaningful. And for people who are involved with health, being able to talk directly about race and not hide it behind place, which is not to say that place shouldn't be looked at, but we shouldn't fool ourselves to think that we can have a conversation about place without bringing in the realities of race. As we began to do that, we focused on things like the stress of living in a racist society. We focused on housing strategies, inclusionary zoning, and ways to be able to overcome the segregation. We have people who are actually studying the impact of segregation and what it brings forward. But also people began to see that investing in community organizing and building the power of people of color to be able to control their own destiny, to be able to step into their power and impact policy, that all of that power and wealth and discrimination, all of these things are part of the conversation about race. And so here we are at a moment where in the public health community, we have understood that the shifting demographics have a lot to do with health. We're understanding that place has a lot to do with what it is about being a low-income person of color that places you at such disadvantage. And we're starting to understand the story of race in America and how we have to bring that forward if we really want to make a difference. COVID-19 has brought all of these things together in a way that we have not necessarily thought about them before because of the addition in COVID-19 of the economy. All too often, we talk about place, we talk about race, we talk about health, and we don't even mention the economy. The economy is one of those things that's mysterious out there. It seems to have a life of its own. We don't know what people who aren't economists even have to do with it. But what we are seeing is the way that the economy has emerged in recent decades and fostered toxic economic inequality that has baked in poverty, that is halting economic mobility, that is hollowing out the middle class. That economy is the economy that COVID-19 came crashing into. And we see that we have so many people who are precariously employed. And the minute that COVID hit, they were just at the mercy of whatever might happen. We see that while people of color have been taken into the economy, they were disproportionately in those frontline jobs that sometimes don't have health benefits, don't have family leave. Many of them don't have sick leave. Many of them pay wages that don't even allow people to live with dignity. And we're seeing that that economy that has so many people vulnerable, that we have to think about it as we're thinking about how to be able to recover to something better. And so people involved in health are now having to think not just about place, not just about race, but also about the economy. And they have to join the struggle for living wage jobs, because if people don't have living wage jobs, permanent jobs, they don't have the access to health that they need. They don't have the security that they need. They don't have the ability to be able to get out of overcrowded housing that exacerbates the spread of the virus. They don't have the capacity to be able to have the kind of stability and stay out of homelessness that we know is so important. We now all understand that paid sick leave isn't just a privilege. It isn't just an add-on if you're lucky enough to have it. It's essential. We need to think about how to really make sure that people can take care of family members when they're sick. And we need to think about how we've fallen into so many people being dependent on a gig economy. It's interesting that we call it a gig economy, because those of us who remember that term, a gig was something you had on the side. How did we end up with a gig economy? Is everything on the side? What about people needing full-time jobs, needing some predictability? We see now with people having to school their children at home, that the absence of predictability makes it very hard to even do a gig job when we have a health crisis. And so it's actually quite an opportunity that we now have brought the economy into our analysis of health and well-being. That we don't just need a strong, fair, inclusive economy to have a strong society. We need it to be able to maintain our health and well-being. And so as we think about going forward, it's taken us a long time for the public health community to really come to grips with the destructive nature of racism. COVID has challenged us in this moment to be able to apply our newfound knowledge to create change. I would argue that the public health community is in an amazing position to be able to really be leaders as we try to build better. We try to come back better. We try to think about how to make sure that this crisis is not wasted. We really need to use this crisis to be able to face the things that cause the nation to be vulnerable and in peril. We need to understand that by focusing those who are most vulnerable, we really do solve the problems for everyone. It's so important to me to think about that. Dean Lynn mentioned that I wrote an article called The Curb Cut Effect. Let me tell you just a little bit about that article. You know, those curb cuts that are in the sidewalk because of the advocacy of people with disabilities in wheelchairs? Those curb cuts certainly had allowed people with disabilities to be able to fully realize the rights that they were fighting for. Didn't mean much to have a right to a job, the right to be able to public accommodations if you literally could not get around your community. We needed those curb cuts to open up opportunity. But how many times have you been pushing a stroller and been so glad you didn't have to pick that contraption up from one corner to another? How many times have workers have their burden eased, whether they're pulling wagons or pushing carts, didn't have to maneuver over that curb? How many times have we had our shoulders go down when our 7-year-old new bike riders are traversing the neighborhood sidewalk to sidewalk because of the curb cuts? It even saves lives. 9 out of 10 unencumbered adults cross the street at the corner because of the orientation of the curb cut. What it shows is that when we solve problems with nuance and specificity, focused on those who are most vulnerable, targeted, discriminated against, we solve problems for everybody. I'll give you a couple of examples. Take not smoking in public places, something I know the public health community is very proud of. That started with flight attendants on airplanes trying to get smoking banned on airplanes, even putting in a non-smoking section, though it helped passengers very little. It helped flight attendants none. When they finally joined with Ralph Nader, that consumer advocate, they were able to get smoking banned on airplanes, which began the movement to ban smoking in public places. It saved millions of lives. Think about one more. I call it the gold standard of the curb cut effect, the would-be gold standard. That's the GI Bill. Would be because it was delivered in a discriminatory manner, but for people who were white, returning veterans, I would say it is no overstatement to say that the GI Bill made the white middle class. And it started because a few leaders thought that about 100,000 of the 16 million returning World War II veterans might need a little extra help. And they designed a program for an education boost and a home ownership boost. 8 million took advantage of the education, many more took advantage of mortgage. And literally, you can count the doctors, the lawyers, the scientists, the senators who were benefited because of the GI Bill. Solve problems with nuance and specificity for the most vulnerable. And you solve them for millions, you solve them for everybody. And so we have the opportunity now as we think about in public health, how do we use what we know and what our focus is in terms of the most vulnerable to be able to help change this nation for the better? And people in public health know about change. You're change makers by design. Very often that change making is focused on individual behavior. Well, we need societal behavior change now. We need to actually sound the alarm that we can't go on as we have been going. We need to build a fully inclusive society, a fully inclusive economy. Everybody needs to live in a community of opportunity, and we need to use this moment of reckoning with race to finally become an anti-racist nation. And it's going to take every sector understanding that, defining it, in order for us to really step into this moment and achieve something magnificent. Thank you.
Well, thank you, Ms. Glover, for those comments. I must say I'm really struck by your comments here in the sense that you've really helped us to think about connectivity, how we're connected to one another, and that those that are discriminated against, isolated, neglected, naturally have increased vulnerability, but that we've got to recognize how that vulnerability is connected to the larger economy even, and the opportunity for all. The pandemic has certainly illuminated some of these issues, made them much more clear. Additionally, I love what you had to say about race and place, and your analysis on segregation really as a way of, that was historically used as a way to facilitate inequities in access to resources. We still see racial segregation and residential segregation to a large extent, but place is really is what's being used there. Place as a proxy for race in terms of access to those resources. So, maybe I'll start out by just asking you, as we think about place, what are the models that you've seen? I know PolicyLink has done work in this space, but there's been work here in Atlanta with purpose-built communities. There have been promised neighborhoods. There have been the Harlem Children's Zone. There have been a number of case studies and success stories. And I'm wondering, as you look at those and think about the work of PolicyLink and the work you've helped to lead, what are some of the key themes that you would extract from those efforts as we think about our work to redefine, reshape place? Because, maybe segregation on its own, some people choose to live with people who look like them, but that shouldn't mean they don't have access to the resources around all the things you listed: schools, housing, so on and so forth. So I'm wondering what you've seen in terms of those efforts, and if there are things you would highlight that are important as we think about how to reshape place going forward.
Thank you for that question. You're reciting those places: Harlem Children's Zone, East Lake, Promised Neighborhoods. It was like just a review of my life. I actually helped Jeff Canada start the Harlem Children's Zone. He and I had been brought together by Marion Wright Edelman, who was the leader of the Children's Defense Fund, to really think about what it is that children needed. And one day we were at a retreat, and Otis Johnson, who was then in Savannah, Georgia, later became the mayor of Savannah, Georgia, stood up at the retreat and talked about, well, we know exactly what children need. And he sort of drew some circles on the board talking about what we need to do is take a community and apply everything that we know children need to demonstrate that it's not a little bit of this and a little bit of that, but it has to all happen together. I was sitting next to Jeff Canada, and he leaned over and said to me, he said, I could do that in Harlem, because he was the leader of the Reedland Center for Children and Families, which then became the Harlem Children's Zone. So I watched Jeff with extraordinary vision, energy, leadership, and insight take 96 neighborhoods in Harlem and lay out what every child in that 96 block area was going to get, and then proceed to build it and do it. And to show that when you do that, you get amazing results. There have been lots of evaluations of the Harlem Children's Zone, and the education ones show the children who are in the Harlem Children's Zone do better than white students in the New York public school system. Not close the gap, but do better. And that is extraordinary. To be able to say, just by making sure that every kid can start school ready to learn, that there are adults who surround them that have high expectations and the capacity to help the children meet their own expectations for themselves, that you pay attention to health, you pay attention to extra activities, you expose, it makes a difference. We have proven that. Shirley Franklin, a friend of mine, she introduced me to East Lake, and I followed it along the way, and I followed purpose-built communities. And I see again and again and again that what Jeff was able to show in New York, they're showing in communities all across this country. When President Obama came in, Jeff Canada and I led an effort to really get the Promised Neighborhoods program in place to try to take the insights and the strategies of Harlem Children's Zone and systematically apply them in communities around the country. Some of them have been very successful, some not as successful. But the point is, we know how to create environments in which all children can succeed. And yet, there's still experiments and pilot programs. And if you're lucky enough to have a leader, have a foundation, have a local elected official invest in your community, then this happens. That's not right. Being able to reach your full potential should not be dependent on one leader, one philanthropy, one moment in time where we focus on something. We need to be able to figure out how to bring that forward. The next thing I want to say about place is that we have learned that these communities actually don't exist in a vacuum. They exist in regions. And that one of the things that will determine whether or not a place can sustain this sort of change over time is whether or not they get connected to the region, whether or not they can access regional opportunity, whether regional decision-making actually is helping to build what's needed. I like to think about regional equity as making sure that within a region, everybody can participate, benefit, their assets are being tapped. And regional equity, I think, requires three things. One is that you can live in a community of opportunity. That if there is a community that has good schools and jobs and all of that, we ought to have affordable housing in those communities so that people have access to live there. The next is we need to connect people to opportunity throughout the region, which requires a public transit system that is focused on people, not necessarily just focused on business, not just focused on what's going to look elegant when you lay it out on a grid, but what connects people to opportunity. But the last element of regional equity is that every single community is a community of opportunity. And that's what the place-based strategies do. But place-based strategies without systemic change do not create sustainable change going forward.
Thank you. Another thing you mentioned in your presentation, you mentioned that this was a time for a racial reckoning. And you also indicated that we need to use this crisis to face issues and to address isolation, discrimination, systemic racism. And so I'm wondering what that agenda looks like. How do we go about that work? Would you share your thoughts on that?
Yes.
And I would also add that at the federal level, regardless of your political affiliation, I think all would agree there's been significant dysfunction there and the inability to get significant work done as of late. And so with that as part of the context, what does this agenda look like? And should it be operationalized at a federal or local level?
Oh, that was a big question. How many hours do you have? I'll try to answer. I'm going to start with What's required during this moment of racial reckoning? The first thing we have to do is that we have to face race. We have to face our history. And the we is not just people of color, it's everybody. Everybody in this nation has to understand that the race problem in America, the problem of structural and embedded racism, is America's problem. And for America to solve this problem, we have to go back and face race. And the unhappy, ugly truth is that this nation was founded on genocide, stolen land, human bondage, and slave labor. There's nothing in those statements that represent an opinion for me. Those are just the facts. And those facts actually have plagued the nation since before its beginning. Because to justify beginning on those horrible things, there developed a hierarchy of human value, which allowed for people who were white to assume that they were more human and more valued than the people who were indigenous, who were being killed and whose land was being stolen. And they were more human than the people who were Black, who were being brought into bondage and used as slaves to build the wealth of a nation. A hierarchy of human value. You know, people can't do those kind of horrible things without giving themselves a rationale. And the people in this country were giving themselves the rationale of a hierarchy of human value. It was not left behind when slavery ended. The narrative that runs in the background of the nation's mind is this hierarchy of human value. And it allows the nation to educate some children with the full wealth and creativity and knowledge that we have about education. And it allows some children to struggle, to be left behind, to suffer from underinvestment. It allows for some people to be able to accumulate wealth in an unfettered fashion. And for others, not just to have a hard time accumulating wealth, but have it stripped from them through fines and fees, stripped from them by incarcerating them and coming out and not being able to be employed, stripped from them in extraordinary ways. You couldn't do that unless you felt that some lives were worth less than other lives. So the first thing we have to do, if we want to really take advantage of this moment of racial reckoning, is we have to face history. We have to face the continuation of a hierarchy of human value. We have to jettison that hierarchy of human value, and we have to tell ourselves another story about who we're going to be. We have to tell ourselves another story about who we're going to be and what our relationship is to each other. And the other thing that we need to know is that if we get it right, for those who have been marginalized, oppressed, and left behind, the nation will fully benefit. This isn't something we're doing for the other. This is something that we're doing for ourselves. What is the agenda once we face this need to face history and jettison the hierarchy of human value? We then need to be about overcoming the harm that we need. I actually think that we need a commission on reparations. And I say a commission on reparations because I think it's going to be hard to figure out the way forward. And we shouldn't let the fact that it's hard to figure out reparations stop us from addressing it. So I would hope that this next administration would appoint a commission on reparations so that we can think about all the issues that have to be thought about. But one thing for sure I know is that we need an apology for slavery. We cannot heal without that apology. And we're going to need strategies, compensation, yes, but a policy agenda that actually begins to create a way forward for those who have been placed at such a disadvantage. It needs to be focused in every area. We need to bring a racial lens to everything that we're doing in policy, to education, to housing, to the criminal legal system, to the agricultural, to farming. In every aspect of the country, we need to bring a racial lens. We need to understand the history. We need to set goals for what it's going to take to be able to have a North Star of fully inclusion. And we need to start moving on that. We need to think about that the wave of young people coming into work and school right now will suffer greatly if we don't intervene. Coming into work in this economy and this has been brought out by the Brookings Institute and studies around the country, that people will earn less in their lifetime if they're entering the economy now, that they will begin to form families at a later date if they form them at all, that it will be very difficult to ever have a home, that the life expectancy will be less, the depression will be more, the mental illness, just by coming into your own in an economic crisis like the one that we're experiencing. So we need to really make sure that we're making education available, free. Higher education is important. That we now, just as we have free education from kindergarten to high school, we need to have free education from 2 to 5. We need early childhood education. Every child needs to have it. It needs to be free. But we also need from 12 to 14 in terms of an associate's degree or a full 4-year education. It is essential to be able to participate in the economy. People of color are going to have a more difficult time accessing it. It should be free, not just because it's the fair thing to do, but it is the thing that the nation needs because we need an educated workforce going forward. So these are the kind of strategies we have to pursue. What people are talking about is how to be conscious about building anti-racist strategies, anti-racist institutions, anti-racist policy agendas going forward. A lot of the language that I'm speaking, I'm sure, is off-putting to some people who think that it's an obsession around race. It's not an obsession around race. It is an understanding that the agenda for equity, just and fair inclusion into a society in which all can participate, prosper, and reach their full potential. That agenda is the only way forward. It is the only way forward. The fate of the nation is dependent on what happens to those who have been left behind. And we know who they are, we know where they are, we know what they need. And if we can get that right, the whole nation will benefit.
Thank you. I'm going to move to some questions that I've received from people who are watching. And I think this next question or this first question really it ties well to the idea of a racial reckoning. And the individual's question is that there's been a national call to defund police, yet there are a range of ideas about what this actually means. You have discussed this topic on Abolishing Policing, your Radical Imagination podcast. Given where our country is at this moment, what do you see as realistic action steps that we can take both locally and at higher levels in addressing the need to imagine and reconstruct how we create safe and healthy communities?
What a wonderful question. I think one of the things that we need to do collectively is we need to go back and ask ourselves, how did we get police in the first place? We have police. They're in every community across the country. Some people are comforted by the fact that the police are there, that if they ever need them, they can call them and they will come with a friendly, concerned face and they will help them. Others are very much victimized by police. There are communities in this country in which almost every young Black man in the community has been given the opportunity to think of himself as a criminal because he has been stopped so many times by the police and questioned. What do you think that does to a young person growing up in a community? And the police are constantly almost asking, so have you committed your crime yet? Have you entered the system yet? What can I do to get you in it? That's a very different view. So we need to ask ourselves, where did it start? And this is how it started. Police began in the South to catch runaway slaves. That's how they started. The police started in the Northeast to be able to tap down the demands of labor as labor was trying to organize for its rights. Police began in the Southwest as the Texas Rangers, and we all know what the Texas Rangers were doing. And so that's how it started. We need to go back and look at that and then ask ourselves, and what are we asking of them now? They began to control and contain and to the people who were of color, poor, trying to seek their rights in an industry when industry was building. And they were protecting private property, protecting white people from the Native Americans, catching runaway slaves. What do we ask them to do now? We're asking them to make our communities safe. And we're a nation that's almost majority people of color. So we're asking them to make communities of color safe and to keep them safe. And then we need to ask ourselves, what makes for safety? If you think about it, what makes for a safe community is not the presence of police. What makes for a safe community is knowing your neighbors, having a level of trust, being connected, living in a community in which people are not desperate. When you think about the things that create safety, it's not somebody with a gun coming in to create safety. It's the relationships of community, and it's the economic security of people and the kind of activities that we have for young people. That's what creates safety. And so when people talk about defund the police, it is really coming from a place of we want safe communities, and we can't get safe places for children to play. We can't get neighborhood associations that have the ability to network with each other. We can't get job training programs. We can't get good schools because all of the money is going to police. And I'm not exaggerating when I say that. In many jurisdictions across the country, from 60 and up of city budgets go to police and fire. Not to education, not to health, not to child development programs, not to community building efforts. And so when people say defund the police, what they're really saying is, let's talk about what it takes to create safe communities and invest in that. And since the only money we seem to have is the money that's going to police, we may have to take it from police. And when in taking it from police, we're not taking away the ability to be safe, we're investing in the ability to be safe. And so I think that people need to give this conversation a chance and not lock down, you're either for this or for that. We need to enter the conversation and ask, what do we want? We need to enter the conversation and ask if the institutions we're dependent on were ever designed to produce that outcome. We need to examine whether or not, as they have tried to change over time, have they been successful? And I think that when we ask those questions and we listen to the answers, we'll see that we need to think about building new institutions using our public resources differently.
Oh, thank you for that. And I want to, in fairness to this questioner, they have a dangling question here, and they say, what is your superpower? This is a question you ask on your of your podcast guests. So this person is putting it back to you.
Not fair. Not fair.
Oh, goodness.
I tell you what I like to think is my superpower. I like to think that my superpower is listening. Yeah, I'm not sure that I use it to the best of my ability, but what I try hard to do is listen. And listen with a respectful ear to know that no matter what the person is saying, in what they're saying is something that I need to know, something that I need to know.
That's
and
great.
Can include it in my analysis. If I can include it in the way I talk about issues, it'll make me more effective as I do so. So I like to think my superpower.
It's a great question, and it's a great response. Another question is, says the pandemic has universally impacted access to safe public transportation. It's really changed, our sort of needs around health and access to hygiene and health supplies, scheduled visits to the doctor, access to nutrition for the elderly, disabled, low income. And the question is, how has PolicyLink and your Radical Imagination podcast empowered communities to initiate / coordinate resources for these groups? So what sort of work is PolicyLink doing, and how is your podcast helping in this regard?
Well, let me first talk a little bit about PolicyLink. It's a research and action institute advancing racial and economic equity and through policy. And we are focused on health, housing, education, transportation, democratic participation, fair and just and inclusive economy. We focus on everything rather than specialize in one area, but we constantly finding the thing that has momentum, because that's where you're going to be able to make change, bringing an analysis that talks about how do we advance racial equity, and always working in full partnership with people who are working for change in their local communities. One of our mantras is that local leaders are national leaders. They are solving the nation's problems. And local leaders who are really effective are connected to the grassroots on the ground, because that's where you get the best knowledge about how to solve these problems in ways that are authentic. And so one of the things that I have been able to do as a PolicyLink is on the Governor Newsom in California's task force for business and jobs recovery, is make sure that I was using my existence on that task force to be a conduit for the things that the community was struggling for, making sure that we were prioritizing the communities that were left behind in terms of contact tracing, in terms of really having campaigns that were culturally appropriate to focus on wash your hands, wear a mask, social distance, to make sure that we were getting at those issues of those frontline workers and making sure they have voice at work. One of the things that I didn't mention when I talked about what we need to do once we understand that the economy is impacting health is how important it is for people who work to be able to have voice at work. When you look at what's been happening in some of the chicken and the meat processing plants, people who are working there have not been defining what the conditions would be. They were not able to sound the alarm. Voice at work is so essential. So we were focusing on all of those things through the work on the task force. And one of the things that came out of the task force, which I think you all might find interesting if you don't already know about it, is that in California, we have certain criteria that counties have to reach in order to begin to take steps to open up the economy. And those, the measures in terms of those things, that were how many people are dying, how many people are in intensive care, how many cases do you have? And so in a gross way, a county could show that it was making progress, but that gross looking at data could hide or mask that a low-income community of color was really suffering and not making progress. So one of the things that Dr. Ghali, who's head of Health and Human Services in California, working with some of the task force members, developed was an equity metrics that actually said that in order to be able to open, counties have to be able to show that they're disproportionately spending their resources in the communities within the county that are disproportionately being hit, that they are disproportionately doing testing in those communities, disproportionately doing contact tracing, have real campaigns to get people to change. So that if you're doing that, not only are you more likely to meet the other criteria, because of course you're going to improve the whole county, but if you're doing that and the whole criteria aren't moving as fast, you might be able to move to open a little better because you had a good equity strategy. So being able to bring equity forward in everything we're doing, being able to bring the voice of people in communities forward into how do we deal with this, and being able to pay close attention to the workers who are most at risk, those frontline workers who really need to be the ones calling the shot about what it takes to be safe, and then making sure that we have an agenda going forward to improve their circumstances so they're not so vulnerable to overcrowding, homelessness, and all these other things that have turned out to be such risk factors.
Thank you. The next question is one about community voice. And the question is, how do you elevate community voice in the policy process and ensure that community members feel empowered to engage in the decision-making process? I know PolicyLink has done lots with local communities and is really, at least as part of its work, focused on mobilizing people to engage.
Mm-hmm. PolicyLink is not a community organizing entity. We do policy, but we do policy from the wisdom, voice, and experience of people who are working for change in the local community. We take our cues about what the policy ideas are from community. And when we go to policymakers, whether we're going to visit a United States senator or a city council person, we go with community representatives, we go with the organizers in the community, because they're the ones who not just have the insight, but they actually have the power. Again, I'm sorry to use so many California examples, but I do live in California. The California Endowment, which is our largest California foundation and is also a health-focused foundation, really over the years has embraced this notion of racial equity and has embraced this notion that to really improve health, communities have to use their power and we have to build their power. And their entire focus is on building healthy communities. And that means building the power of the people in communities. So they invest heavily in the organizing groups. They get behind the campaigns that the community and the organizing groups want to see happen. And while it makes real progress on issues like being able to close down juvenile hall, being able to get more focus within the criminal legal system on making sure that people have the health care they need, that they have things they need coming out, getting rid of people going to jail for low-level offenses, really attacking the 3 strikes and you're out, making sure that schools have clinics. So they've done a lot of very specific things because they have taken their cue from community. For example, Bob Ross, who is the president of the California Endowment, says that the California Endowment would have never focused on stopping suspensions if it hadn't come from the community. It's the community that said that these suspensions are just part of the pipeline in the prison. They keep kids who need to learn from being in school, and there's no standard. And so this whole system has changed completely in California because of the advocacy of grassroots organizations funded by the California Endowment. So if you're doing policy work, you need to be doing it from the wisdom, voice, and experience of the people. And if you're funding and trying to solve a problem, you need to know that you need to be building the capacity and investing in the power and the wisdom of the community. And what I wanted to say is that even though we've gotten all of these wins, what we really have gotten is engaged communities who bring their democratic participation to everything that they're doing, and it will definitely serve them and California well going forward.
Thank you. We maybe have time for one more question, and this is a sort of a broad question, so I'll let you interpret it as you will, but this person wants to know about the voice of African American males and where are the voices of African American males? What's your perspective and views on engaging Black men to take a rightful stand and be recognized in this struggle? What suggestions or advice do you have to motivate and encourage Black men to become more prevalent in, I assume, in this discussion on racial justice? And the person says, I'm a Black woman who is fully engaged. As a Black woman who is fully engaged, how do you begin a dialogue with the brothers? She says, without coming off as a male basher or one-sided egotistical viewpoint. So, broad question, but what are your thoughts on that?
A broad question, but one that I've been living with for a long time, because one of the things that we did at PolicyLink early was encourage a focus on young Black men. We recognized early on, particularly because we were looking at what was happening in the criminal legal system. And you notice I say criminal legal and not criminal justice. I really do think we do ourselves a disservice by not acknowledging that there's very little that has been just about the system. So we call it a criminal legal system that we hope will achieve justice. So we began to focus on the criminal legal system, and we saw what was happening to young Black boys, teenagers, young men. The other thing that we recognized early on, and this was before the My Brother's Keeper initiative, this was back in the day, early in the PolicyLink development, is that there are not a lot of places for support for young Black men, because what actually happens is if they drop out of school, they often don't show up in any system unless it is the criminal legal system. Not true for women, who often are showing up when they take their kids for baby visits, when they end up having to seek out certain kind of supports. But these men were completely forgotten. So we thought that we needed to have a specific focus. And we began to work with several foundations, developing the focus on Black men and trying to figure out, how do we understand the data? How do we go forward? Then President Obama, picked up on it and did the My Brother's Keeper initiative. And we were very involved at PolicyLink in helping to shape that and inform that and provide technical assistance around the country to groups that were trying to be part of the city initiative there. So the answer to the question is absolutely. We need to be focused, and we need to be focused beyond the criminal legal system. Every time we start talking about Black men, we shouldn't be talking about the criminal legal system. We need to be talking about starting school ready to learn. We need to be talking about supports within the school system to stay in school and be able to achieve their fullest. We need to be talking about how to make sure when people come out of high school, they can pursue higher education, and they have the ground, they laid the ground for them to do this. I'm going to speak about Jeff Canada again. Jeff Canada focuses on making sure that every child who goes through the Harlem Children's Zone goes to college, and they're prepared to go to college. And a lot of people have said, but a lot of kids don't want to go to college. Some end up not going to college, or you're doing a disservice by focusing everybody on going to college. And Jeff's answer is, if you're prepared to go to college, you're prepared to do anything. And so if somebody comes out prepared to go to college and they decide to pursue a career that doesn't require it, that's their choice. And choice is a choice, not that's the only thing that was available to them because their education was so limited. So focusing in these kind of ways, what I got pushback on was often from women who felt that focusing on Black men was neglecting women, was looking at the data for Black girls. It's almost as concerning as that for Black boys, and looking at how women have double, if not triple, face double, if not triple discrimination. And so I really take the position we need to focus on making sure that all can participate, prosper, and reach their full potential. And then once you say all, you say who is not getting it. And once you see who is not getting it, and you see that you can identify that by groups because of their gender, groups because of their sexual orientation, groups because of their race, whatever it is, we need to have specific strategies that engage them in thinking about how to go forward. Everybody needs to have attention paid to them.
Well, Ms. Blackwell, thank you so much for sharing your insights today. I want you to know it's been I'm delighted to have had this opportunity. I mean, I really have found your insights to be rich and powerful. Your vision, what you help us to see in terms of possibility and opportunities for a better nation, really means a lot. And the time you've taken with us is greatly appreciated. Whether or not you know it, you infuse optimism, inspiration, and belief when you speak. And I really feel that, and I know that others participating in this lecture today do as well. We really hope your remarks are a catalyst for continued dialogue and action, and that we can dedicate ourselves to institutionalizing equity in our public health practice, as you have suggested. I want to thank all who participated today for joining the School of Public Health Kreuter Katz lecture on health equity. This live stream has been recorded and will be available on the School of Public Health YouTube channel shortly. On behalf of the School of Public Health at Georgia State, thank you and stay safe. Bye-bye.
Thank you. It's my pleasure.